Heart valve transplantation in Turkey. Why is this type of medical help so popular among foreigners? Why do they choose Turkish cardiologists? What advanced methods do they use? What is the TAVI method? Why is it considered revolutionary, especially for the elder people? To learn about this, we visited a special Turkish cardio center and met with a doctor who treats foreign patients. For now, I am one of those doctors who perform the most surgeries by TAVI method in the whole world. I have some patients in other countries. I operate not only in Turkey. We have special videos about other types of help from Turkish cardiologists. You can find the link in the description. Don't miss our videos. We have lots of useful information for medical tourists in Turkey. Aortic valve replacement might be necessary if the natural valve in the person's body becomes faulty or damaged. This valve connects the heart and the aorta, regulating the flow of oxygen-rich blood throughout the body. Thus, valve dysfunction results in insufficient blood flow into the aorta and causes backflow into the heart. Causes of valve dysfunction can include age-related changes or genetic defects, or sometimes bacterial infections can affect the valve too. 15 years ago, in order to replace the aortic valve, it was necessary to perform an open heart surgery. However, the majority of patients are elderly individuals, and surgical operations pose significant risks for them, making it quite dangerous. With the introduction of the minimally invasive TAVI method, this problem was solved. Professor Refik Emre Altekin, the head of the cardiology department at one of the leading private hospitals in Antalya, Turkey. He graduated from the renowned Akdeniz University, where he also built his academic career. He is a lecturer and practicing doctor in several clinics. He is married, has 2 daughters, and enjoys playing football and music. The TAVI method was initially used for patients who could not undergo traditional surgical intervention due to the high risk of not surviving an open heart surgery. Now, this method is applied to all patients over 70 years old who require valve replacement due to developed dysfunction. So, the concept of a patient with aortic valve stenosis, inoperable due to age-related risks, does not exist with the TAVI method. TAVI is the abbreviated name for transcatheter aortic valve implantation. This is a minimally invasive method for treating aortic heart defects, especially in elderly people who have contraindications for traditional open heart surgery. This operation is done under general or local anesthesia on a beating heart and without using any heart-lung machine. Surgeons most often gain access to the heart through the femoral artery, which is located in the thigh. The procedure is monitored using an X-ray machine. A special thin, flexible catheter, equipped with a small balloon and a folded new valve, is inserted into the patient's body. The catheter is guided to the heart, and at a specific location, the valve opens when the balloon is inflated. The advantages of this method are quite clear. It is minimally invasive, so the patient's chest does not need to be opened, which is why even elderly people tolerate the operation pretty well. The recovery period is shorter, the risks of post-operative complications are reduced, and lifelong anticoagulant therapy is not required after the operation, such as the medication warfarin. The procedure usually takes about an hour. After the operation, the patient must spend 1 day in the intensive care unit for monitoring. The patient is usually discharged after 3 days, and sometimes they can be released even on the 2nd day. That means patients come for this particular operation and leave on their own. Long-term hospitalization is not necessary. Are there any contraindications for someone who would like to undergo TAVI surgery? There are not many groups of patients for whom the surgery is not allowed. Initially, we performed it only on patients who couldn't undergo open heart surgery, but now it has become a routine procedure. We usually do not perform the surgery on younger patients because the average lifespan of the valves ranges from 10 to 15 years. And you see, if we perform the surgery on a young individual, they might need another intervention in the following years. But if young patients have some additional risk factor, for example, severe heart failure, or maybe brain issues, or maybe they have problems related to walking, then this procedure can be performed, even if the patient is pretty young. Can a patient, knowing their test results and health condition, decide themselves that they want to undergo TAVI surgery? After the patient reports symptoms, they need to be examined first. When the examination reveals that the valve stenosis is serious and there is a risk of worsening, further steps are considered. The operation can be done in an open manner, and naturally the method is thoroughly explained to the patient. But in a typical scenario, the patient might prefer the TAVI method. This particular surgery can be performed in an elective manner. And when the situation allows the patient to choose the method of surgery, it is highly unlikely they will opt for open heart surgery, since the TAVI method has a significant number of advantages. With the advancement of technology, most surgeries that are traditionally used to be performed on the open heart can now be done using closed interventional methods. Therefore, it is recommended for each patient to fully understand if their surgery can be performed using a closed method, since the majority of heart surgeries can now be performed by experienced cardiologists using minimally invasive techniques without open surgical intervention. Transcatheter aortic valve implantation, abbreviated as TAVI, like any other heart surgeries, should be conducted only in a well-equipped clinic and, more importantly, by experienced specialists. To choose the right clinic and doctor, it is advisable to consult independent medical experts. In Turkey, this can be done for free through a special service company. Their employees are practicing doctors with diplomas and extensive experience working in Turkish clinics. They are well versed in the specifics of this field.
After a person submits a treatment request in Turkey, we, the coordinating doctors at Healthy Turkiye, select the best clinic and doctors for him based on the diagnosis, preferences and needs. As practicing doctors in Turkey, we know precisely how to perform it accurately, swiftly and effectively. Next, we coordinate with the patient the treatment plan and constantly accompany him throughout the trip, as well as stay in touch for any questions even after his return home.
Now I am one of those doctors who perform the highest number of TAVI operations globally. I am a lecturer and a practicing physician for several medical companies. There are patients in other countries for whom I perform surgeries. I operate not only in Turkey. Sometimes people ask me if I can come with my team to perform the surgery. Since 2017, I have performed around 500 or 600 TAVI operations. Why do you think foreign patients gladly come to Turkey to get treatment from Turkish doctors? First of all, medical education in Turkey is equivalent to that in Europe. Based on the experience of doctors, their knowledge and their surgical skills, we are not lagging behind Europe. But compared to Europe, the cost of our services is more affordable. And our prices include not only the cost of the surgical services themselves. Considering this, it is not surprising that people prefer to come to us here in Turkey, because Turkey has a price advantage, along with the expertise of its doctors and hospital equipment. For consultations, you can call or write at this phone number or through the chat on the company's website. The website address is on your screen. There you'll find a lot of information about other areas of health tourism. Another source of information about medical tourism in Turkey is the Healthy Turkiye Instagram account. You can subscribe via this QR code or the link in the description. If you enjoyed today's issue, please hit a like button and subscribe for more new videos about medical tourism in Turkey.